So we are going to move on to the last section, the Furious Five. These are 5 questions that I'm going to ask every guest. So
Okay.
question number 1, what advice would you give to a student trying to pursue a career in public health?
Technical advice: get as much experience as you can, get a mentor, and even if you lack experience, always present yourself as professional and open to any new experiences. But on a personal note, for professional development, I will pass along the best piece of advice I received that's helped me through my career from one of my professors, Dr. Sunshine Cowan, and that is, you are not the expert. Your community is your expert. So every situation you go into in public health and community health, you are impacting an entire population of people. And even if you are part of that community in some way, you are not the expert. Your community is your expert. So you always need to listen to your community.
Yeah, I love that. That definitely resonates because we have a certain perspective, and that might be a very drastically different perspective of what the community members are seeing and what they're needing. So definitely having them as part of the conversation is important, especially when we had a lot of bad public health and health research in the past that has just kind of used the populations without actually
Mm-hmm.
trying to use them and build that empowerment in there. So that is definitely very important. Thanks for sharing that. So if number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
I would tell them to get as much experience as possible with presentations, data management, and community partnerships. And if they're in a position right now and there's any workforce development or any QI going on at work, to get involved with those projects. I work in a team of 3. I'm very lucky. I work with 2 very talented other women my age, and we have a PIO that we work with closely, so technically 4, all really talented women, but each of us has a very different background. 3 of us have MPHs, but our backgrounds are completely different, and our experience leading up to this position were different. But it was mostly just willingness, openness to work, experience of some kind in public health that you can translate to this role from a more strategic lens and from a more program lens, and being able to present information and synthesize information was very important for all of us, and we use those skills all the time.
Okay, thank you. And that's very informative, and that's something that I think any student can use to really build like presentations. That's something we do in school, like data gathering, data management is something that we learn, report writing. So yeah, definitely thank you for that. So number 3, what's something you are working on improving in your life right now?
I think I'm always trying to improve on learning to rest and learning to engage in activities that allow me to kind of quiet my mind a little bit. And I think that will help me professionally, because if you are always consumed with work 24/7 or with public health or the pandemic 24/7, it's not so great for you in the long run. So I'm constantly having to remind myself to take time just for myself, and it's an ongoing battle.
Yeah, and one that's absolutely necessary during a global pandemic. You take your time for yourself,
Mm-hmm.
Shelby.
Thanks.
So number 4, professionally, do you recommend anything, a book, a podcast, or a show, or anything?
Oh goodness. There's not like one book that's ever changed my life for public health. I think getting as many different perspectives as possible is my recommendation. So try out a podcast for a couple episodes, try out a book for a few try something until something resonates with you, and then kind of go with that. And as far as what that subject matter is, I think anything on social justice, anything on racial justice, and things like segregation is really important for anyone practicing public health. Because if you come from a rural Oklahoma area like me, you might not understand those lenses until you get in there and really dig deep and read memoirs and interact with. If you're not able to interact with people in the community yet at work, start read people's stories. I think reading people's stories is very important. So I recommend getting a variety of perspectives, especially memoirs as well. Memoirs are really important. So
Okay,
that's
that's
very
powerful.
broad and very general, but
No, I like that a lot actually, because that I haven't thought about that, but that is definitely something because the memoirs do capture people's perspective, what they were thinking of a situation, what they were doing, and that is history, and history definitely informs us of what to do moving forward. So
for
I'll,
sure.
I'll take that into consideration, and when I'm buying my next few books, definitely. So the last question is, where can people connect with you?
So you can find me on Instagram at seriously.shelves. That is my handle. And you can also find me at my website, shelbygravesfreelance.com. So pretty straightforward.
Okay, great. Thank you. And I will link those in the show notes for anyone that is interested. Um, but yeah, this is the end of our interview. Thank you so much,
Yeah,
Shelby. It has been a
thanks
pleasure.
so much.
Yeah, look forward to
It's been
chatting
great
sometime
talking to you.
soon.
Yeah. Thanks for letting me ramble about public health. It's my favorite thing to talk about. So
Awesome. I hope we have a lot more conversations going forward.
for sure, definitely. Thank you.
You're welcome. Enjoy the rest of your night.
You too. Bye.
Bye bye.